But I think Lucas' presentation is better than mine. You should hear this before you get tired. This is a good one.
So it's yeah, you alluded to this a little bit today. So Lucas is from Brazil as well, another one of our Brazilian colleagues. So he's going to talk about sports injuries from the perspective of complex systems and anti-fragility. He discussed with one of our athletic trainers over at the Shoemaker, and he was very interested in that. So that's something that, yeah, I mean, definitely interested in. Hopefully, we can incorporate some of this in our programs here. So thank you.
Thank you guys for being here. Thank you for making this possible. Thank you for being present. And thank you, Grant, for making this so special. This is a real special part of this trip because of you. You're making this thing different, you know. So again, thanks everyone. So I come from Belo Horizonte, one of the major cities of Brazil. I didn't put up any slides concerning my city or my university because there's too many slides already. So this is the main university of the state. It's quite large. And now we have our athletic facilities as well, and mostly in the university. I see our athletes over there too. But I also work in private practice in a private clinic, just like Lucio, and in a private hospital as well. So this is where my city is in Brazil. Okay. So I would like to start with the quote of the main person I'm going to be talking about for the next few minutes, which is Nassim Nicholas Taleb. He's an economist and a mathematician working in New York, but he's from Lebanon. So education makes the wise slightly wiser, but makes the fool vastly more dangerous. So we got to be very careful to what we do with our knowledge. And I'm going to be talking a bit of why. So there's no conflicts of interest to be clear. I'm going to be talking about some companies over here. I don't have any stocks or whatever from them, although I know the people who own the company back in Brazil. So I would like to start by asking you all, for you, what is the difference between complicated and complex? Most people use them as if they were synonyms. But when you talk about systems, especially dynamical systems, they're not synonyms. There's a very important difference between them. And I believe that most of the failure we've been failing when trying to prevent diseases or injuries comes from the lack of this knowledge specifically. So here you can see two papers from the same journal, the British Journal of Sports Medicine, from the same edition, using the two terms as if they were synonyms, but one of them is actually wrong, okay? So what's the current paradigm here? We are frequently failing to prevent injuries approaching isolated known risk factors, as we can see in many papers. Like here, we talk about today controlling food pronation for athletes. Mm-hmm. And I like what he said, like not everyone's gonna come here. We wait for them to have problems. Yeah. That's a good approach. Because we can see that most people who have a slightly different way of attacking the soil, they don't have troubles with that. And if you try to change the way they move, you're going to fail. So except if you have a very badly pronated approach to the soil, then you don't need any special technological devices. You can see that with your own eyes. And another study here showing that we actually had fewer ligament injuries, but no preventive effect on muscle injuries and severe injuries for 11 years at the UEFA Champions League. These are the best soccer players in the world, the best well paid, and we're failing to prevent injuries on them. Or this other one, for collegiate injuries in 15 different sports, we can see that no significant change in game or practice injury rates was noted over the last 16 years. That's very important. Like, I mean, we are failing. We are failing big time here. Or sometimes in medicine and in orthopedics, we end up with unintended consequence. We might end up causing the exact disease or injury we're trying to prevent. As when we keep patients on bisphosphonates for too long, they just break their bones. We're trying to prevent breaking bones. And that's the situation. So where are we failing then? We're probably trying to do a linear reductionist analysis of the problem. We're mistaking complex for complicated in an attempt to break down a big problem, which is the injury, into smaller units, which are the risk factors, as if it was a Lego construct. We can take the small pieces out of it, it will disappear, but that's not how it goes. And we're going to be talking about systems then to understand why that's not how it goes. So we may have linear dynamical systems and nonlinear. Among the linear, we have the simple ones, the complicated ones. Among nonlinear, chaotic and complex ones, which is the main topic of this presentation here. So in a linear, simple system, it's pretty straightforward. So you have the variable, which is A, that leads you to the result, which is X. So if you fall down from 10 meters high, let's say, you're sure going to end up in a hospital bed or maybe in a graveyard. Yeah. That's what happens. In a complicated system, it's like a motor engine. You have lots of factors influencing the result, which is X. And if you take one of them out, or if one of it fails or breaks, the engine is going to stop or stop working properly. But if you're a good mechanic, if you have studied this, you know what bit to change, it will go back to work. So it's pretty linear. Among the nonlinear systems, we have the chaotic ones. You're probably all familiar with the butterfly effect, of course. So a small difference in the input will lead to big changes in the output. But we're here to talk about complex nonlinear systems. And that's a system when the factors, they interrelate to each other in different manners, and that changes a long time. And from this interaction, it rises, there's an emergence of a system, of a way that it works. And it's been used for many different fields of knowledge, just like sociology, engineering, psychology, and my preferred one, which is economics, which took me to this kind of understanding and studying. And actually it's coming already to sports medicine. This is a study, we're going to go back to this paper here. You can see the same figure over here, and on the last one, it's about the same. So it's arrived to us already, okay? We just don't know. So how can you recognize a complex system? They are dynamic, but the other ones are dynamic too, but they're pretty unpredictable, and you can find contradictions in that, just as we saw when using biphosphonates. There's redundancy. So you have different variables that do the same thing sometimes. You can see, for example, the gluteus medius and the gluteus minimum, they do about the same thing. So if you lose one, another one will keep up, and you might not end up having a problem. So that happens a lot in complex systems. And in Google, Amazon, they all know that. You can find fractals, usually into them. That's a property which was described by Benoit Mandelbrot, which is a French mathematician working in IBM for a long time. So you can see the same patterns happening in different scales within the systems. Like for us in anatomy, as Professor Houston would like, we can think about the sarcomere has about the same shape of the muscle fiber, and that has about the same shape of the muscle, which might have the same shape or about the same shape of the whole compartment, where you can find muscles that do the same function. They're usually self-organized, as we saw. There's no boss who tells the other ones what to do. They all have equal importance over there. And there's another very important characteristic, which is the outliers. And they must be called, well, I mean, they were suggested to be called by Nassim Taleb the black swans. Probably all heard this term. So a black swan is an outlier that's so important, but so important that it changes everything. So we are used to discard the outlier, but if it's so important, it might dislocate the mean to the left or to the right. Imagine in a linear system like the height of everyone, if the tallest man in the world walks into this building here, what's going to change in the mean height? Nothing. Maybe half a centimeter. But what if the richest man in the world walks into this building? How's that going to change the income of everyone? It's going to dislocate a lot to the right, okay? Hi, Elon Musk. So, how to behave in complex systems? Well, we can use aphorisms for daily life when you recognize a complex system. So they are these heuristics that indicate what you should do. They're very unspecific and they're supposed to be. So think about a bad map is worse than no map at all. So if you don't know what's happening, it's better not to know. It's better not to think that you know. So if you have a bad map, you're always going to end up at the wrong place. If you don't have a map, you're going to ask, you're going to look for directions. And understanding is a poor substitute for convexity. So there's a hierarchy on behavior in complex systems. It's better to have good models. It's better to know how to behave instead of trying to know everything, because we're not going to know everything. And we actually can see some papers prior to that one that do this kind of thinking, okay? Just like this one. You shouldn't try to analyze every movement that the athlete is doing, or try to find proper shoes or insoles for each athlete. It's better to use a perfect movement path or just a comfort filter for picking the shoes. You all must remember Scotty Dye. All his work was quite perfect for complex systems too. And, but to go forward with how to behave in complex systems, we'll have to talk about fragile and the opposite of fragile. So for most of us, fragile will be described like something that breaks easily, that tears apart with very little aggression. So what's the opposite of that? Most people would say strong, resistant, or resilient. But that's like saying that the opposite of hot is warm. Because the opposite of losing or breaking with aggression, with volatility, would be gaining from aggression, which is anti-fragile. So Nassim Taleb had to come up with this new term. He searched like 200 languages around the world, couldn't find this word. So he had to invent it. So in antifragility, we try to gain from aggression or from volatility, if you're talking about economics or finance, so that you benefit from the unknown and protect yourself from the black swans, as they're very unpredictable usually. So this would be a convex curve. When you grow with the stressor line, the system gets better, gets stronger. But you can also be concave or fragile within your system, and then you would lose with the stress. So talking about finance, they tried, and they're still doing that, and they're still working on this, to move from a predictive model, which is the Markowitz model. Markowitz was a Nobel Prize winner in the 70s, and he tried to come up with a perfect portfolio to balance yourself in between risk and profit. So it looks a lot like the bell curve over here. So you would position yourself, your economies, in the middle of the risk. You can push a little to the left or a little to the right, depending on how much risk you can take. But then they proposed this other model, when you will be extremely conservative. It's called the barbell model with most of your investments, but extremely aggressive with a small part of your investments, which is the barbell strategy. It's an unbalanced barbell. So when a black swan comes, like the 2008 crisis, these will go to zero. These will go to zero as well, but these might go to 100%, 200%, or if you know how to position yourself or how to measure the fragility of the system, you can buy a lot of insurances, and then these might end up being 1,000%, let's say. Okay, yeah, let's carry on. And it's being used in medicine already. You can see some papers over here. This is for chemotherapy, for cancer therapy, let's say, using fragility. You can see studies with antibiotics, and actually to try to make the bacterial system more fragile, then you can attack it. And you can see it in genomics. That's probably the most developed field in medicine with complex systems. But we can think about other ones too, like eating properly. So once we should usually have a balanced diet for, let's say, 90% of the time, but then you would be fasting, or you should go to a Brazilian steakhouse. You should go to Grand's mom with 4th of July, and then you eat as much as you can. That helps the system to become more resistant, to be able to face the future black swan is going to have. And that's what the big religions have been doing for the last thousands and thousands of years. And we have some papers showing how good having a diet related to the religious beliefs, it's profitable, let's say. You can use it to analyze medical practice. That's very complex too. Think of a patient that has infection, the one that Lucy was saying. One patient can ruin your career, can break a hospital. So it's a black swan. So how do you protect from this patient that you don't know who it's going to be? You buy insurances, of course. But how should you behave in this complex system? Maybe we should be very, very conservative with most patients, like do nothing, let's say. So you will just try to restore physiological state through good counseling, through placebo, through very safe medications like the nutraceutics, let's say. And in just a few of the times, you should take them to surgery, do interventions, or maybe even use anti-inflammatory drugs. As we can see, we never know who is going to be that patient that's going to have a kidney failure. So was it worth it treating a little bit of the pain of 999 patients if one is going to have such a big problem. So that's what we call a negative asymmetry. Okay? You cannot compare those 999 with this one. This weighs a lot more. This is the black swan. And then we can think about fractals too over here. We can get this part of the barbell and split it again in another barbell if you want. So what kind of surgery should we be doing? 90% of the time, or let's say from 80 to 99% of the time, very safe and conservative, but low aggressive surgeries. And 1% of the time we should throw the kitchen sink at them, right? Or we're getting there, we're getting to the point. Maybe use it to maximize the benefits of exercise. You can already see some attempts to bring antifragility in this kind of convex behavior to physical training with, let's say for us, a low physical demanding lifestyle, and once every week, let's say, you get your mountain bike and you ride for 150 kilometers, let's say. And you do HIIT, high-intensity interval training, for example, you do CrossFit. And that's proving to be even better than have that daily routine of 2 hours walking. Day by day, we're getting more and more evidence of this. And it's coming to sports medicine, to sports orthopedics too. Here you can see a timetable on Osteotar, which is it's a very cool article. And they go all the way from 1992 with trying to predict injuries all the way over here to complex model in 2016 with this paper, which was actually written by Natalia Bittencourt and her colleagues at my university. They are physiotherapists over there. And so here's an example of an ACL injury in a basketball player and in a ballerina. Okay, so in this one, they might have very important factors, just like dynamic knee valgus, for example, hip muscles weakness. These might be so important that if you change this one, if you cancel this variable, you might have good results. So that it looks like it's linear, but it's not. You must know that you're not dealing with a linear system, because if you transpose it, the ballerina is not going to work. They don't do dynamic knee valgus usually. It's the other way around, right? So we would have everything, and we would have to know that we'll never know every factor. And maybe we can bring this to do proper training periodization. So you probably all know about periodization. So you kind of injury the athlete with more demand, more high level, high demand exercises, and then you let it rest, bring down the level of demand, so that they will heal those micro injuries, and next time you get better and better and better until you get the Olympic Games, let's say. It's not infrequent that the trainers will lose their hand on that, and they will end up in overtraining injuries, or maybe an acute injury like an ACL. So what could we do? Maybe we could dose the antifragility of the system to try to do the convex training periodization. So you have a lot of recovery time off, technique training, and you have once in a while very high load demands. But that's good enough for us. How about our athletes? Maybe in our athletes we can have a fragility index model. So it's based on big data. You have to have a lot of numbers, a lot of inputs, and the computer will sort out through artificial intelligence, machine learning, and it will tell you what the index is. Is this athlete fragile, or is he in an anti-fragile moment? If he's in a concave scenario, if he's fragile, you should decrease high demand stimulus. So the left side, the right side of the barbell should be brought down maybe to 0. Okay? And when he is very convex or anti-fragile, you increase the high demand stimuli. And it's been done already by this company. They just released their numbers in the common press about a month or 2 months ago. And these are the results with Liverpool, which is one of the main teams of the world, let's say, for soccer. But they're working already with the NBA, NFL, and some other teams. And that's very impressive what they had with Liverpool. See, they, for the total days lost to injury, decreased by 32% from one season to the other, and 40% decrease of days lost from substantial injuries. That changed everything. And now we have this company in Brazil as well, also based in my city, by physical sports educator and orthopedic surgeon. which is called Omni, but the program is called Apollo. They use a lot of thermography. They are starting to use genomics. And of course, they use GPS and they use lots of lab data to get to this fragility index of the players. And they're into a lot of Brazilian soccer teams right now and starting to work also in Portugal and Turkey. So, answering that first question, complex and complicated are indeed different, okay? Not mistake one for the other. Or according to Woodhart, which was a British economist, who was the head of the Bank of England in the 70s and 80s, when a measure becomes a target, it ceases to be a good measure, especially if you're talking about dynamics, about complex systems. Then you're going to be treating the scoreboard of the game, not the game itself, you know. So that's it. Questions? Thank you.
That's great. I think great talk, and this is something that we're just so key into everything's linear, just.
Yeah.
But I mean, I think you mentioned Scott Dye with the bone scans to determine like when someone is ready, which no one buys into, but a lot of this probably.
Yeah, I mean how do you say that? The etiological diagnosis when you're dealing with complex systems, they're usually not as good as the syndromic diagnosis. So he came up with anterior knee pain, which is a syndrome. So it's good to be in a specific in this kind of scenario, you know?
Yeah.
It's better to be like that. We're usually trying to think like, I need more knowledge in order to prevent every injury. It's better to know that you're not going to have all this knowledge, never.
Yeah.
You're not supposed to have, you're not going to have. We're trying to measure more and more, and that's okay. We should do it. But if you put on a hierarchical point of view, the model, the behavior is more important than knowledge. It's knowledge coming in second place. You have to know what to do with this knowledge. Or with the lack of knowledge, of course.
How long ago did they start with Liverpool? When was that? When did they start playing?
Well, they compared the second last season to the last one.
Okay.
So they started in 2020.
Okay.
Yeah.
So their whole idea is basically to develop an everyday fragility score on players and say, you're in a fragile state here, we get decreased your demand today, or you're not ready to play at this high level yet, etc.
And
then determine it.
In training high level too.
Yeah, and then determine where you go the next day, or maybe a weekly thing or a monthly thing.
Yeah, that's the idea. And there are different ways to deal with that. I quoted two of them here. One is the aphorisms. Just the pattern of behavior should be like this. It will fail once in a while, of course. Everything fails. And there's the other one that demands big data, which is not easy to do. You guys might do it here in this university, but we're not going to do it with our outpatients back home. So there are other methods to try to deal with complex systems too. Sometimes you have one variable that's already a complex system within itself, like thermography. It's like that. So we might be able to analyze the pattern of distribution of natural numbers within this variable. Like you've heard about Fibonacci and Pareto distributions, there's other ones too. And you can check, it's a good triage to check if there's something wrong. What is wrong? I don't know. Something's wrong. And then you could go to big data, or you could investigate the knee or the back, or the low back, or whatever, the shoulder.
What kind of data are they using to determine kind of those two topics you mentioned? Are they using like kind of the data from like smart technology with heart rate variability and strength testing? And
Yeah, they don't
scans?
tell us deeply, but I know they're using GPS, especially for soccer. People run a lot, of course. They're using a lot of lab data, like lactic acid and stuff like that, creatine and creatinine, and they use thermography. Imagine thermography, that's crazy, like every pixel, and those cameras are very sensitive, every pixel is a data, is an input. Genomics, they're starting to find some very interesting things with genomics, and they don't even need to find all those things. You have to suppose that it might work, then you give it to the computer. It will sort it out for you.
Machine learning to some extent.
Yeah. In economics, it's very impressive. Like some computers realize that when you're dealing with cryptocurrency, for example, it's better to look at the press. What are they saying? How many people are searching for that on Google? Maybe that's better than all those parameters and graphics and everything.
How hard is it to convert? Is the goal to convert a fragile system into an anti-fragile system, or is that, or do you just kind of, can an athlete move into an anti-fragile case, or is that we always have to be cautious that they are going to be an anti-fragile system?
Well, that depends. First, you need to be feeding the system all the time, so that it gets to know your athlete. You know, they're trying to do that for the drafts too, but it's with the physiology department of the club or of the university, whatever. So we all have a computer inside us. We know the patient comes in, this patient is different. So you need to tell the system that you want to do it again. So it's probably some patients for muscle injuries, they realize that many times it's going to be three days, sometimes it's a week, sometimes that's a month, and the index won't go down. So it's patient. You must know that you don't know.
Yeah, no, I think it's great because there's so many. I mean, I think especially with our therapists and athletic trainers working with athletes, we have some data on how hard to push them because we really don't know. There are some people that you can power through things and they do fine, but other people it's a negative to the fragile systems, and to be able to predict that would just be phenomenal, and that would be helpful from a rehab standpoint.
But of course, those companies are there to make money, so they won't tell you everything.
They won't tell you everything. Well, you need to get your own system and then patent it. Then you'll be one of those companies.
I don't have what it takes. I'm sure.
I'm sure the military has some data on training recruits, and some systems like this, but they would never share it for like SEAL training and stuff like that.
True.
So it was a complex talk.
Complicated.
Complex for me. Complicated. And the reason I would like for you to send it to me, because I'd like to actually spend some more time. Because it's, just having a quick presentation, I don't think I caught it all. And I'd like to actually spend some more time thinking about the impacts.
You see, it's been like 20 years reading about these things for me. I love this.
Okay, so you got 20 years on me. I need some time.
So I can send you a whole lot of suggestions of books and
Yeah, no,
papers.
it's a very
I'll be
interesting
glad to do
topic.
it. I've been trying to work on papers on this for the last 5 years, but it's just not me. I'm not a research guy. I have a hard time on doing these kind of things. So I've got a bunch of things to say.
Yeah, well, first, send the presentation, maybe I can then look for what you've been reading. So very, a completely different presentation. It's very well done.
Oh, no, yours.
No.
Gotcha. No, yours will be great.
No, this is great.
No, this is great. Thank you very much.
This is different.
Very good.